Get a sneak preview of a new study done here that gives us more clues about how long the effects of COVID-19 can last. CBS 2's Jackie Kostick tells us what the study at Northwestern Medicine has uncovered.
I spoke to a doctor here at Northwestern who said that most people who have lingering symptoms do fully recover within 4 to 6 weeks of having the virus. But for some folks, those symptoms do persist for months and in some cases well over a year. While doctors say it's too early to know whether Omicron will cause long COVID in the same or different way than previous variants, the team at Northwestern's Neuro COVID-19 clinic is learning more about some of the first people to experience long-haul symptoms.
There are patients who present with a persistent neurologic problem now lasting 22 months.
Dr. Igor Koralnik is the chief of neuroinfectious disease at Northwestern. He says the team is working on a follow-up to a study first published in February of 2021, which tracked 100 of the clinic's first long-haul patients. Of the patients tracked, 70% were women, the majority white, average age 43. They had not been hospitalized with the virus, but had long COVID symptoms develop after, including brain fog, headache, fatigue, and issues with smell and taste. Now, Koralnik says it's been at least 14 months since symptoms started.
Unfortunately, we saw that most symptoms persisted in those patients, except for disorder of smell and taste, who tended to improve over time. But we also saw patients who developed new symptoms over time when they didn't have them before.
The good news, Koralnik says, is that everybody tends to improve over time.
And some people tend to improve faster in certain categories of problem. Some people tend to improve, it takes longer for them to improve. We can't give a prognostic for single patients based on the group evolution, but we can tell them that in general, things are going to get better.
Because there is no one-size-fits-all diagnosis, Koralnik says possible treatments vary by symptom and patient. As for the research suggesting that getting vaccinated or boosted after infection could help long haulers recover, Koralnik says he's not found the vaccine to cure or worsen long COVID in his patients.
Sometimes patients have a transient reaction, but not that different than people who are healthy and never got infected. May have a bit of a sore arm, or maybe a little bit of a fever or fatigue. Some patients said that it reawakened the long COVID symptoms, but only for 24, 48 hours. We never really had patients who said that their long COVID was cured by the vaccine, but there are patients who are getting better anyway, and so they got the vaccine and they're still getting better.
Koralnik says people should still get vaccinated and continue to follow CDC guidelines to help prevent getting the virus in the first place. Koralnik says the clinic has seen more than 1,100 patients since the beginning of the pandemic. They've actually had to increase staffing to keep up with demand, and they're currently scheduling appointments several months out. Jackie Kostick, CBS 2 News.